I worked with a gentleman who actually a couple of years ago got an award for being a paramedic for 50 years. I was a new paramedic when I started working with him. And he jokingly would say all the time, I'm a trained observer. That's how I saw that. And I took that to heart. I try to be a trained observer. I try to see what's going on around me, not necessarily the exact thing sitting in front of me, but the environment, that awareness of what's going on around you. When I was a new EMT and starting out, we had a freight train in the town that I worked in, and it went maybe 5 or 6 miles an hour. And somehow or another, somebody always ended up getting their car clipped by that train. It was an unguarded crossing. It just had the flashing lights. It didn't have the bars. We're seeing this many car accidents. Why is this an unguarded crossing? How can we work with the railroad to upgrade this crossing? Little things like that started me thinking. When you start thinking about highway safety, I'm in a car accident on a highway. I pull my ambulance up behind the car because the accident's in front of me. Well, maybe I should pull my ambulance around the front of it so that I'm not stepping out as traffic's coming at me. Or maybe I get the fire department to put a fire truck across 2 or 3 lanes of the highway. So now I'm protected by something big and red. It's little things that have made me think over the years, how can I do this emergency better and this emergency safer so the next time it's automatic? I spent the first 3 months of COVID muttering, wow, never thought I'd do that in my career.
Every day, right?
Yeah, every day. COVID was an interesting thing because we were directed by the state of New York to start doubling and tripling capacity in some areas. How do you double ICU beds? You move med-surg areas into cafeterias. You build partitions. New York State brought in the USNS Comfort. They brought in the ship, the hospital ship, and that was impressive.
Yeah.
And they built a large hospital in the Javits Center. The problem with both those facilities was the patients that were in our hospital wanted to stay in our hospital. And they did not want to be discharged because that was a discharge to go out to those facilities. And we listened and we heard what they were saying. I remember it very, very well. At 10 o'clock on a Sunday night, my phone rings. And it was my VP. So I'm like, hey, boss, what's up? He said, tomorrow morning, 9 a.m., be at Columbia. I went, oh, okay. What am I doing? He goes, I don't know. We'll tell you when you get there. Okay. We walk into one of those soccer bubbles, those big white bubbles, AstroTurf field, goalposts hanging from the ceiling. He looks at the group of us. There's probably about 20 of us there. And he says, all right, today is Monday. Next Monday, we're opening a hospital in this space.
Wow.
and the group of us kind of looked at him and we looked at each other and we're like, okay, sure, boss, no problem. Let's do this. I walked the space with one of the architects and we measured out the space and he went back to his CAD program and another guy had figured out how much space we need to put in low acuity cubicles for patients. We figured out a way to bring in oxygen. They built an oxygen farm outside the bubble and piped it into the bubble. We had to extend the doors, the Sally Port doors, so that we could get patient stretchers in and out in those Sally Ports without, bringing the bubble down on top of everybody. That following Tuesday, we accepted our first patient. And we built a 288-bed unit in that soccer bubble.